Go.
Hello, everyone. I hope this message finds you safe and well. My name is Magic D. I'm one of the organizing members of the Urban Democracy Feast. I'd like to take an opportunity to introduce folks that are on the committee as well. Laura Sprague, also Dr. Yvette Hyder. Also not with us is Narda McClendon. And also speaking with you today would be Dr. Santiago Velez. Will be speaking with you about Urban Democracy Feast. So now I will leave it to Dr. Santiago to explain Urban Democracy Feast.
This is an event that we do twice a year in order to raise funds for the projects that address social justice gaps in the city of Kalamazoo that are not going to get funded by the philanthropic institutions in the city because of their social justice nature and their efforts to redistribute access to all the resources and all the services in the city. In keeping with the guidelines of the federal and state governments, we canceled the feast that was supposed to be held on the 28th of March because the gatherings have 10 times the number of people that are limited given those state and national guidelines. Instead, we are going to do a series of podcasts that will try to address uh, some of the problems with the state of preparedness in the city of Kalamazoo, the causes of those gaps, the problems with prevention in the city, and the problems with planning to deal with the consequences of the current pandemic in specific areas with regards to the economic depression that is sure to follow this pandemic, with regards to the problems with the homeless and the people recently released from prison, problems in the public schools and in higher education, the services and support for people who are housebound, for people who are sick, and the people who don't have funds to deal with having been laid off or permanently uh, released from their work, all as a result of this problem. So we are going to deal today in this particular first podcast with some of the gaps that require immediate attention. This planned series is going to be available at the website of the Urban Democracy Feast, at the website of Magic Radio, and the Touch, as well as some of the other electronic media in the city where you can consult them at your leisure. You can also respond on those websites, and you can send us emails through the Urban Democracy Feast, or if you have a phone call to send to us, you can call 269-388-3809. We are also going to create in short order a platform for community-wide discussions about the social justice gaps that this current health crisis and economic crisis has revealed, the causes of those gaps, and the ways we can solve them together, particularly identifying who profits from this current situation. So before we start, today we're going to talk about the state of health preparedness in Kalamazoo County and in Kalamazoo City. And I'm going to do that as well as give you some background about the situation in the state that creates the problems. So I will get to that first. The state of Michigan as of 2016, is one of the states, one of the 10 states with the worst income gap in this country. Thanks to the right to work laws, thanks to regressive tax policies, and thanks to the reduction of income tax credits. And within the state, the worst income gap between the extremely wealthy and the rest of us is in the highly gentrified area of Grand Rapids. This southwestern quadrant is the quadrant in the state that has the greatest wealth gap between the very rich and the rest of the population. The top percent of the population in the state owns 22 times more wealth than the bottom 99%. Between 1979 and 2007, the income of that top 1% increased by 100%, and their control of all the income in the state doubled to 18-20% by 2013. But for the rest of us, income declined, and the purchasing value of that income declined as well with inflation. More specifically, women make $12,000 less than a man doing the same work every year. And workers of color make $3 per hour less than their white counterparts. And the gap increases the more education that people have, with consequences for access to childcare, to paid leave, to credit, to college education, to retirement, and a tax policy where salaried workers pay twice the state and local taxes of the wealthiest 1% of the population in the state of Michigan. Now, let me get specifically to the problem that has to do with the causes of this preparedness gap for a health crisis like the one we are currently experiencing. Until 2017, let me repeat that, until 2017, 2 years ago, 3 years ago, if a working family lost their jobs, nearly 40% of us would not have enough funds to live for 3 months. That's the case for twice as many families of color as for their white counterparts. And the dire conditions under which the workers live here makes it very difficult for 1/3 of us in the state of Michigan to save it all. That is 1/3 of the population in the state of Michigan, the working population in the state of Michigan, does not have a savings account, which means that we're one emergency away from an economic crisis. The median net worth of a white family in the state of Michigan is $91,000, while for households of color, the median net worth is $4,000. But it's probably worse given the small sample for the estimates that I have just cited from Prosperity Now. Nevertheless, 42% of the families do not have a savings account at all, and 25% of the families in this state own nothing. This state, Michigan, is also one of the worst in terms of schooling segregation and housing segregation. And back to 2010, 10 years ago, statewide poverty for the children in Michigan was 41%. And between 2008 and 2015, child poverty increased, according to the Michigan League for Public Policy. Now, that's some of the background for this discussion about the health preparedness gaps and the health preparedness problems that we're facing at the moment. So what I'm going to do now is discuss some of those problems and then leave you with some questions for discussion with your relatives over the telephone, over email, over Skype or Uvu, as you prefer, given the current stay-at-home restrictions that we are obeying. According to the World Health Organization, every city in the world needs at least 800 beds for every 800 hospital beds for every 100,000 people. In Kalamazoo, there are 805 beds in 2 private hospitals. According to the Borges Hospital website, according to the website in the National Hospital Association for Borges, and that information was given directly to me by Bronson Hospital. There's 434 beds in Bronson and 371 beds in Borges. That leaves 1,200 beds outstanding. 3 or 4 weeks ago, the county commission, the Kalamazoo County Commission, signed a contract with Fort Custer for the use of an additional 1,200 beds in a military installation. Now, what is the problem? That does not solve the lack of ventilators in the county and the lack of ventilators at Fort Custer, or the lack of public hospitals in Kalamazoo County, nor the absence of a universal health insurance with a single government payer. Now, second problem, or third problem, the health insurance and the ventilators are the first and second problem, and where the beds are located and the absence of a public hospital in Kalamazoo County. According to the University of Pennsylvania, even if we were able to reduce the contamination rate by 95%, we would still need over 1 million beds and respirators in the United States, and many more given the amount of doctors, nurses, and cleaners that will eventually get sick, and those beds and ventilators do not exist in the US at the present time. And if we start producing them now, many people will die before the production factories deliver them to the hospitals and to the counties and to the states where they are needed. First question, what will the School of Medicine do here in Kalamazoo? What will the public health faculty do? And what is being planned for the use of the student dorms at K College and the local public university as we make plans to face this epidemic? Last Thursday, 2 days ago, there were over 3,000 cases of coronavirus contamination in the state of Michigan already. The figures are usually 8 days behind the reality because it takes 4 days between the time the test is given and 4 days to get the test back to the person involved. The state of Michigan is also one of the states that is doing the least amount of testing. Third issue, how many ventilators are there in Kalamazoo County? Fourth question, what is the economic plan to get us out of the economic depression that will certainly follow the resolution of the epidemic? What is going to happen to the people that are not covered by private health insurance connected to a job? What happens to the people who lose their job and who therefore are not covered with health insurance? What are the plans for April and for May And what do we do when the coronavirus epidemic comes back in the fall? 3 more questions. Question number 7 is, what does this situation tell us about the efficiency of an uncontrolled market where states and counties are competing with the federal government in a bidding war, not just for the ventilators, but also for the safety equipment that the doctors and the nurses and the janitors need in every hospital, in every senior citizen's home, in every prison, in every state hospital. And those safety tools and that safety equipment is not available because somebody, other state or some other county or the federal government outbid the place where you live in order to get access to that equipment. 8th question. What is the speed at which the supply chain will deliver the orders submitted by this county or by this state in order to procure the respirators and the safety equipment necessary? And last question, what is it that we're going to do when the contamination with the coronavirus spreads to the prisons and to the state hospitals and to the senior citizens' homes? I hope that gives all of you food for thought and a number of questions to ask the government bureaucrats and the professional politicians in Kalamazoo County and in the city of Kalamazoo. In future podcasts, we will address some of the planning gaps and some of the prevention gaps. At this stage, we are trying to introduce the issues for our discussion, and the other people who will participate in this podcast will address how we stay healthy and what are some of the major problems in the public institutions with regards to prevention and with regards to solving the health considerations and the legal considerations of this epidemic. Thank you for your time, and stay home and stay healthy. I'm done.